Good morning. It is indeed an honor to be here this morning as your new president. The BC Nurses Union is the strongest union in this province. The BC Nurses Union is the most inspiring union in this province. We are the voice of over 43,000 professional nurses. You have heard me talk previously about being your voice, but my voice is your voice, and your voices are the stories of the patients and residents you care for every day. In May, 10 years of work by the BC Nurses Union is culminating when the Medicare protection case finally gets its day in court. Dr. Brian Day and his consortium of private clinic owners want to tear down our public health care system and instead ensure that if you have a wallet, you can buy your way to the front line of care. Well, the BC Nurses Union stands up for health care, and we will continue to stand up for public health care even on the steps of BC's courthouses. Because of the work that all of you have done, including the after-hour walkabouts, weekend visits to the hospitals and care homes, we have a clear and disturbing picture, the facts about the horrendous staffing our members are placed in every shift. These victories take work, and they don't come without personal sacrifice, and for that I am truly grateful to all of you for all of your hard work. Please congratulate yourself. Because of your hard work, the BC Nurses Union has filed over 4,200 grievances in just 6 weeks. Congratulations again to everyone who made this happen. I know that you worked day and night on this Grievalanche. Thank you. You helped get their attention to do what they should have done 2 years ago. Implement a fairly negotiated agreement which was signed and ratified by both parties. On the eve of our convention, I received the following points referenced in a letter addressed by the Deputy Minister of Health, Stephen Brown. Dear Gayle, we recognize that there have been shortcomings in the implementation of some of the agreements entered into as part of the 2012-2014 collective agreement. The challenges that health employers and the NBA have faced have resulted in a number of grievances and understandable frustration amongst nurses. These issues pose an obstacle to constructive collective bargaining and our ability to work collaboratively together. The Deputy Minister went on to say, and I quote, "I want you to know that you have my firm commitment, as well as the commitment of the health authorities, to work constructively with you in the months ahead to come to a mutually agreeable resolution that will benefit patients and nurses alike and put the Ministry, health authorities, and the BCNU in good standing to move forward constructively to support strategic change and continuous improvement of the health system." You folks did this. You folks did this. In October of 2014, the BCNU demanded action from the Ministry of Health to ensure measures were implemented across the province to protect the health and safety of members who would be tasked with the care of an Ebola patient. And who would that fall to? Nurses. BCNU continues to advocate provincially for the use of respiratory protection in all care circumstances. N95 masks must be part of a baseline protection, and believe it or not, we are still fighting about N95 masks. We're still fighting. They are still insistent a surgical mask is effective in caring for an Ebola patient. But Ebola is one of the many infectious disease possibilities that face our members every day. There is SARS, there is measles, there are all kinds of things that we must be ready for. This highlighted part of the issue, but we have to do everything we can to make sure that we are ready for any infectious disease outbreak. This is the reality of the century that we are currently living in. Burnout, stress, anxiety, moral distress, PTSD, depression, suicide. These are some of the other words captured by the overarching term mental health. Why isn't mental health considered equal to physical health, with the same resources, expertise, and access? Every family suffers from mental health issues. My own family suffers from mental health injuries, and I use that word with intention because I believe a mental health injury should be treated no differently than a broken ankle injury. Promptly, safely, and with supportive care. You know, you can't talk about mental health without talking about violence. It is the unfortunate reality, though, that violence against nurses occurs in every worksite in BC. It is not the fault of any nurse who gets assaulted, has their hair pulled, punched, kicked, slapped. And it cannot continue to be an expectation of this job. These are some of the reasons behind the launch of BCNU's new policy on protection against violence. We have waited too long for the government and health authorities to take action, and our nurses have the broken jaws to prove it. We will review the new policy in detail during the operations report, but its purpose is to provide financial, legal, and professional assistance to mitigate damages, restore health, and attain justice for our members. We will file grievances and take strong legal action against the employers and the assaulters of nurses. We will demand charges be laid. I believe it is in the best interest of the union to ensure that the hard-earned dollars that are given to us in dues are directed effectively to our members, be it in a $25 million strike fund, a Grievalanche, a round-the-clock violence hotline, or bargaining for improved workloads and safe patient care. We need to make sure that union resources are directed to support the workers of our stewards. I want to ensure that our members receive the service that they need in their work sites to make sure their issues are addressed in a timely fashion. This is critical work for us. The real bottom line is what is best for the members. It was the strength and unity of purpose and hard collective effort that resulted into 4,200 grievances in just 6 weeks with strong government response. And it is this unity that will move us forward to a successful contract. Please stand by your bargaining committee. Stand alongside your council and leadership. Stand alongside your regional executives. Stand alongside your stewards, your friends, your colleagues on every unit across this province, and please stand with me united for safe patient care. Thank you. Let's have some fun.